Here and a good morning to all our speakers today. We are talking live from the Share Hub, bring our professors. We are going to discuss about urban health, food security, and climate policies. What does the intersection of health, food, climate, agriculture, migration, and its consequences really mean for climate action? How do we really look at integrating line ministries and bringing together different departments to look at human beings as the center of climate policies, climate action, and identify solutions that really matter? So we have a stellar lineup today. And to introduce them one by one, we have Lauren Baker, the Deputy Director at the Global Alliance for the Future of Food. We have Jess Bigley, the Policy Lead for the Global Climate and Health Alliance. We have Sierra Seka, the Negotiator for Agriculture for Gambia, and also the Chairperson of NFUF Excellence. And one by one, I would like them to introduce their work and also the things they do at their organization and how this has implications for climate policies. So we'll begin with Lauren. Could you talk about your work at the Global Alliance and how this fits into the big picture of COP, the discussions and moving things forward?
Absolutely, and thank you so much for hosting us in this panel. It's great to be here together. The Global Alliance for the Future of Food is an alliance of philanthropic foundations working together and with many partners on food systems transformation. And we have a number of program areas that relate to food, health, climate. One area is kind of an integrated strategy across global fora. And what a really important element of that is to connect biodiversity, health, environment, climate, equity, livelihoods through that journey, including the Committee on World Food Security, the Convention on Biological Diversity, and the Climate Convention, the Land Convention. So we try to bring an integrated message into global fora. And an important part of that strategy is working with leaders from around the world who bring their own perspectives, grounded perspectives into that conversation. So that's one area. We also have a really growing initiative around agroecology and regenerative approaches. We've done work on the food, health, climate connection and nexus. And we also really like to uplift examples of transformation, stories of transformation, because our members are funding incredible work around the world, and that's the reason why we're here, because we all have hope for a different future, and a future that has people at the center, that has an ecological worldview. So I'll stop there and pass it over to you.
Thank you so much. My name is Jess. I work with the Global Climate, the Global Climate and Health Alliance, specifically on our policy work. And the Global Climate and Health Alliance is a network of health and health professional organisations, and we work in very close partnership with members of the climate community to make sure that the health community is aligned with wider climate community asks, including in the UNFCCC negotiations. And really the approach that the Global Climate and Health Alliance takes to our work on climate and health is really looking at how health is determined not only by action in the healthcare sector, but by action across health determining sectors. So how we design our energy systems, how we design our transport systems, our food systems, water and sanitation, recognising that 95% of emissions come from sectors that are not the healthcare sector, and that there are excellent members of the Global Climate and Health Alliance's network that do work on mitigation in the healthcare sector, but unless we mitigate all across all sectors, we won't prevent the health impacts of climate change, and we also won't reap the co-benefits that we can get from transitions across those other sectors, including the food and agriculture sector. Of course, this isn't just about mitigation. There are really key health linkages across sectors for adaptation. We know that if people don't have access to safe living environments, so the cities, the homes, the buildings that they work and live in, that they won't be able to be healthy in the face of climate disasters. If we don't have resilient food systems, people will not have nutrition security. And if we don't have resilient sanitation systems, then waterborne disease is a real risk. I'll stop there and really looking forward to the discussion with this wonderful panel today. Sarah.
Thank you, and good morning. My name is Sarah Saika. I am the lead negotiator from the Gambia for Agriculture, CEO and for Excellence Foundation, which is a community-led NGO and initiative focusing on inclusive education and also cuts across a lot of cross-cutting areas like agriculture. We work with local community women in their farms, women gardens. We work on agroforestry project to reforest our degraded forests, as that's a adaptation agriculture that we focus on in our least developed countries. At the school level, we introducing agricultural sovereignty, which is really connecting that also to health, growing a lot of what we consume, and obviously also looking into bringing up life and livelihood, especially for vulnerable people like girls and women, and so you name it. Also touch going down to the shelter, which is more of like social services. So just putting all that package together at the more professional level as a professor at the Gambia College and then the University of the Gambia, which are the two public institutions as well in the country. We create student support centers, so we are leading the guidance and counseling department into really dealing with crisis when it comes to the environment, when it comes to food security, food safety, and sustainable development in general. So it's a very big package, which led me to just define my name as, sustainable, inclusive, resilient agriculture. And I'm like, okay, Sarah, you have to build up this framework, like really, sustainable education, building capacities and their knowledge in agriculture, in just development, as Gambia is one of the most vulnerable countries. And then our main focus is also standard of living, development, and food security. And obviously we cannot forget about food systems when we talk about food security. But we bring in that as maybe the production and then consumption and how that is affecting our health every day. Thank you.
Yeah, thank you. Gulbanis, probably you can pull a chair and come front, please. Yeah, so meanwhile, I have been quite intrigued with how the negotiations at COP are taking place, and please, wherein welcome Gulbanis. Just for your note, this is also being recorded live, and we have Sanjay as well. Come in. Just
very important assessments from certification schemes that are outside the organization, global certification schemes. They are the ones certifying as a third-party or sustainability on the criteria. So one of the biggest measures we are doing right now then to implement is making sure that policies all over the globe include that sustainability criteria.
Yeah, so some housekeeping information again. We are joined by Gulbanis and Sanjay as well. So I will give the mic to them before we continue for a brief introduction about your work that you do at the Azerbaijan Rural Women's Association and some critical points about your work and how this is also influencing human development. If you can begin, please.
It's on? Okay. I am chairperson of Azerbaijan Rural Women's Association. This association is first to bring the voices of women farmers and entrepreneurs to the table. The development challenge which we address is how the woman, in particular the women in remote villages and small towns, can diversify their incomes and contribute to development of their community, to diversification of the economy. So in response to this challenge, solution tested elsewhere for 30 years, self-help group model was introduced in Azerbaijan, and it was introduced under a big project, rural investment project, funded by World Bank, implemented by Minister of Agriculture of Azerbaijan. And within the framework of this project, some pilot women self-help groups were established. Right now, there are 50 women groups in Azerbaijan, and the groups, they save together, and with group savings, they start their businesses. Then they expand their businesses, diversify their businesses. When their businesses grow, they hire the woman, unemployed woman in community. The target is expand collective women businesses in the country in the shape of women cooperatives, which they have legal status. Women groups, they are illegal groups, but women development, women cooperatives, they are legal registered groups. Women groups are delivered different trainings. They are equipped with business skills, with financial literacy, technical, agro-technical skills, life skills. The groups also are given all health awareness trainings. In these trainings, the women are warned about their necessity of the checkup in different stages of their age. And once per month, they carry out checkup in community, checkup for women and children in community. They invite doctor from clinics. In some women groups, in some villages, there are doctors who organize it as a charity. So its impact to development. Women, when they are in a group, they produce more, they sell more, and they earn more. So this is good for women to be together because they share together, they share their problems, they support their businesses to push forward. The main challenge in rural areas of Azerbaijan right now, it is infrastructural, especially energy. There is no stable energy in some remote villages, which we are trying to shift to alternative energies like sun panels, like renewable energy. So this is all which we are doing. We are trying to increase the digital capacity of rural women. we regularly we provide them digital trainings, equipments, and they are right now we have 45 women women platforms, women farmers platforms. They come together in WhatsApp groups. They have webinars, online meetings, etc. So this is all.
Sure. So, Sanjay, maybe a bit of introduction about your work, both as a space scientist and now at ESCAP, and how did you transition into the interface of disasters, climate, and those kind of things, and what's the kind of message you want to give us?
Thank you, Dr. Edmond. Thank you, colleagues. It's a privilege and honor to be here with you as a panelist. I'm Sanjay Srivastav, Chief of Disaster, I'm Chief of Disaster Risk Reduction at United Nations Economic and Social Commission for Asia and Pacific. This is the regional commission of UN General Assembly located in Bangkok, especially for Asia and Pacific. So in my role as Chief of Disaster Risk Reduction is to ensure that disaster risk reduction related sustainable goals and targets, which are all there across various goals and targets, should be implemented by the country for which we do analytical work, regional cooperation work, and capacity development work. So that's the overall under the sustainable development goals, how disaster resilience can accelerate the process of achieving sustainable development goals in Asia and Pacific region. If I cite one example to make you a little more clearer, we did this year 2023, we published SDG progress in Asia and the Pacific across all 17 goals and 160 plus targets. SDG 13, that is the climate action, is the one which is regressing. Forget about making progress. It's regressing from 2015 onwards. So that shows the progress, especially on climate action, is, in many countries the regression is very fast. And in many countries there are some little progress. We did a very diagnostic analysis where the goal is regressing, why the goal is regressing. There are two areas. One is, of course, the mitigation related targets. This is one which is pulling this goal down. But equally important is the adaptation target, which is disaster related. The people who are impacted by disaster mortality, economic impact on the disaster. So this is one of the drivers of, why we are not able to achieve sustainable development goals. So unless we arrest this train, it will be very hard for Asia Pacific region to achieve certain amount of progress by 2030, which is just very close by. That's my professional affiliation. We have 53 member countries, including Azerbaijan as a part of ISCAP member country, 9 associate member countries. Most of them are like American Samoa in the Pacific. So those are the countries we work with them under the different disaster risk reduction program with a focus on sustainable development goals. Prior to coming to the United Nations, I was a space scientist basically. We were tasked to develop a tsunami warning system after 2004 Indian Ocean tsunami, and then scale this to other for tropical cyclone, for floods, for drought, for the glaciers, all that kind of, because these are all based on the satellite-based monitoring station. So I came with a science background. So there are very few scientists in the UN system. I am one of the rare in the UN dealing with SDG. So thank you. Thank you, Dr.
Thanks for that wonderful introduction, colleagues. And now moving to specific technical areas, I'll start with Lauren. And can you talk about what are that 3 to 5 important critical issues on food systems which you believe should be addressed and tackled, not just at a COP level, but at a world level for issues that really matter? And how does this snowball into climate concerns? Probably 3 to 5 areas very close to you which you feel needs to be addressed, not just at COP, at other negotiations or G20s and other government meetings, but at a global level for stakeholders of food systems and climate. What would those be?
Thanks so much, Dr. Edmond. And earlier in the conversation, we were talking about how do we understand people at the center of this conversation related to food systems and food security. And so maybe I'll start by just kind of framing the health impacts of food systems because they're actually really significant and systemic. So we often think of the health impacts of food systems from a human health perspective around diet, nutrition, but actually people are getting sick all through the food system, and in fact the food system is one of the most dangerous jobs and occupational hazards. So people are getting sick because they work in food, from inputs, the dangerous work of farming in many cases when the farming is industrialized, industrial animal agriculture production, mechanization, packing, and often it's women also who are in those jobs and are getting sick. So people are getting sick because they're working in dangerous jobs across the food system. People are getting sick because of environmental contamination in the food system. I mean, we have highly toxic, highly hazardous chemicals that we're applying in the food system, and many of those chemicals are dumped from North America and Europe into other countries. And so this is a big issue in the Convention on Biological Diversity. It's not so much an issue here. Those are also very fossil fuel intensive agrochemicals. So people are getting sick because of environmental contamination, and people are getting sick because they're eating contaminated, unsafe, and altered food. So we know that food safety is an issue across the food system. So you know, I don't need to say more about that, but that is a big health risk, actually. And then people are sick, of course, because of unhealthy dietary patterns. We see that all the way from malnutrition, stunting, to non-communicable diseases, the escalating costs of non-communicable diseases. And then people are sick because of food insecurity. It's a sort of correlated issue. So I think that framing really helps us see the whole food system and the ballooning costs of poor health. And so I just want to make the link to our conversation around the work that you're doing with women and the work that you mentioned as well, because often it's women through the food system that are most at risk. And also in terms of the urban food system, we have a lot of movement and mobility between rural and urban areas around livelihoods and agriculture and in food informal markets. And so that nexus is a really important and understood, underreported part of people's health experience and contributing to climate impacts as well. So I think I'll end there, but this is related to our work in true cost accounting too, and I think relates to work that we need to do in urban areas around disaster management, because of course food security in disasters is like one of the first issues that we need to be concerned with. And when I worked at the City of Toronto, we mapped, how vulnerable citizens were in a climate emergency because of only a 3-day supply of food. And the whole system kind of disintegrates when electricity and the energy system and the grid and the food supply system is disrupted. So these are just some of the kind of overarching framing that help us understand this nexus between climate, health, vulnerability, and food security.
Thanks, Lauren. That's a very interesting take on the integration of different areas. And I'll now move on to Sira about how you really think we can bring this integrated links into climate negotiations. You've been a COP negotiator yourself. We're hearing about climate finance, different countries having divergent opinions and also interests. So how do you really feel that we can start to now bring food security, health, migration, agriculture, and all of this into climate goals, not just looking at a theoretical framework of the Paris Agreement, which was constructed, but into making the Paris Agreement a really living document which puts human beings at the heart of sustainability. What are your preliminary thoughts on it?
Thank you, Dr. Edmond, and thank you, Lauren, for connecting those dots, because you can't separate the puzzle. They are all connected, and I think it's just the call for more awareness and more collaboration. And so, obviously, food security production, it's on Article 2 of the Convention, which us as least developed countries, we refer to a lot, because also noticing that priorities are different across. And as you said, maybe in Toronto, we are worried about, when electricity is out for 2 days, we're going to have food waste. We're not going, but for countries like mine, we don't have electricity at all. And so I tell this story all the time. I grew up meeting my parents, practicing food system, I call it social technology, when we don't have modern technology. And so we are looking at from production to consumption. Of course, yes, we're using animals maybe for transportation and all that stuff. But the challenge is when we look at the rural areas is maybe if you cook a meal, you have to eat it all or it's bad before the next day. And oftentimes families might need to save some food for the next day. And so when you look at the effects of climate and the climate policies, and also the many years of not being able to define what climate finance is and getting the support on the means of implementation for food, for health, for gender, with the work with women, it's very concerning. And so then the issue of now, what do you prioritize? Where is it food security? Is it health? Is it that? And so, and when you are left with those options to pick, then health is at risk. Everything is at risk. And so, at my country level, we heavily focus on building the sustainable development, focusing on food security. And when we talk about that, we are looking at the availability, it's force. We are blessed with a very fertile land, but a lot of the communities don't even have the access and the opportunities to develop those lands into agri farms to actually get food support if the other systems are not working. So that's one. And then also you can go deeper into affordability, availability, accessibility, and all that. But then looking at also the health, which I think leads us to the unhealthy diets that we have every day. And I often say, in the most vulnerable countries, people often mix up what health and wealth is. And so if I'm in my village and maybe I have my family in the United States or in Europe or in Canada, I feel very healthy or wealthy if I get canned foods from the containers, which also someone is manufacturing or producing and getting sick from all the issues you mentioned. But also, you're really looking at how long those canned foods or those frozen meat take from all the production from the global north and now shipping it to the global south for consumption. And we can talk about these issues, I guess, all day, but it's just I think, a very concerning situation. And then also, I think that leads to the reason of urbanization as part of the conversation. So a lot of the young, energetic generation, they don't want to suffer like our parents. So they all now tend to move to the city to maybe find whatever job you can find or do whatever you can do for living. And when you also connect that now to migration, people dying in the Mediterranean Sea for better lives. So I think really, obviously the climate finance issue, we're not going to dive deeper because it's all hanging there. We can still figure out what that means, and I hope sooner than later so that people can really come out and give what it needs to really do the work we need on the ground. When I talk about agriculture, food security and food system in the UNFCCC, now I'm almost saying, okay, should we start to talk about food justice? You know, so we can keep going. But yeah, I will stop there. Thank you.
Yeah, thanks, Hira. And now I'd like to go to Sanjay about you've heard food systems, you've heard the issues of agriculture, you've heard migration. How does this really fit into what UNSCAP and probably you as an individual can really do into putting this as national policies for country governments, where the Economic and Social Commission can start to look at a social, environmental, commercial and economic determinant of health and build a mandate or build a narrative or maybe even a soft policy which can really put countries into thinking of how this could shape for a better future.
Thank you, Dr. Edmond. Let me share something from the science perspective and then UN perspective on this issue. If you look at, because I would like to touch upon the food system, particularly agri-food systems, how it's impacted so severely by climate-related extreme events, slow onset events together. Our analysis, global analysis, FAO did, that also includes Africa, Asia, all over. The impact of disaster, if it is felt the most, particularly in the agrarian economy, it's a agri-food system. It's not the production of, the agriculture, is also consumption, everything from production to consumption, whole agri-food chain severely gets impacted by disaster. The analysis also highlights that many countries where there are intergenerational poverty which persists, many even in the middle income country, one of the region is the disaster impacts are so deep through the agri-food system that people are not able to come out of the poverty generations after the generations. So we did one analysis on inequality, particularly in Asia Pacific regions. And there are many drivers of inequality, and disaster agri-food system, through agri-food system channels is one of the drivers. So let's recognize the fact, the nexus which my colleagues are talking about, nexus of climate, disaster, agri-food system, and then impact on the people. I would like to tell you that in many parts the migration, urbanization has also been driven by agriculture not doing well. We don't have resilient agri-food system. Whenever there are severe, massive drought or flood, the people migrate from rural comes to the urban. So this is a reality in many middle-income countries, least developed countries worldwide. But coming to the solution part, I thought I must flag to my colleagues a very recent summit of the future of the United Nations. It was on 22nd to 23rd of September. In midst of all crisis, whether it is a climate, it's a conflict, it's all kind of global turmoil. I would like to flag what came out in the end, which is very helpful on the topics what we are discussing. They call 5 pillars of strategic foresights, which a country, can adapt. This is the future of summit key recommendation. The first one is anticipate the risk. Anticipate the risk doesn't mean only anticipate when disaster will hit, how much it will hit. Its impact on the nexus of a climate, disaster, food, all this nexus. So anticipate. Then the second one is downscale the risk. It's not enough to anticipate. You take it to a down the line, a very granular level. Who is going to hit in case of food system? The production part, consumption part, supply chain part of the food system. Where is, what is called the risk, which can be downscaled at a very granular level for policy action. So that is number two. Number three is create an action scenario. When there is a nexus like climate, disaster, food nexus, you cannot do a simple linear modeling. You need to be scenario-based approach of the analysis, where the food which is produced, whether it experienced drought, so then what is likely to be the deficit of the flood, how it is going to impact the consumption in the cities, all that. So you have to analyze action scenarios. So this is the third action point, future of the summit. The fourth is leverage crisis response platform. Every country has a crisis response platform of different kinds, where they manage the crisis. But many times the crises are not managed based on a realistic understanding of the risk, especially the cascading risks. They are not able to anticipate this. So build this crisis platform at the country. In many countries they call disaster management authority, the food emergency platforms, many government, UN agencies, civil society organizations. So these crisis response platforms can be made from a local, national, regional, global linkages. And finally, be prepared for a riskier times, riskier from all point of view, and more so from the agri-food system, which are going to experience more risk in coming days than what it is today. So these 5 pillars of the future of the summit, I feel I must flag for the discussion. Thank you.
Thanks, Sanjay, for flagging the future of the summit pointers or take-home messages for shared learning and understanding. And I would now come to Gulbanis and then to Jess. We've heard about the issues of rural to urban migration, and I wanted to understand, what do you feel is the current situation in Azerbaijan? Are the women folks looking at migrating to cities like Baku, or are they looking at jobs and being based in their own regions? Do they feel that probably migrating to cities would give them a better life? So what's the kind of thought process you observe in many of the rural districts that you work in Azerbaijan? And what do you think it would look like in the next decade or so? What's your thoughts on that?
Yes, the women in the rural areas, they think if they migrate to the cities, it will give them better life. But practice shows on the contrary. Because they leave all their resources in rural areas, and they do not have such a high capacity to do something in city and earn their livings. So they don't have even space to live in cities. They rent some apartments, live 1-2 months, and the money finished, then they go back. So, like group businesses, like collective businesses, they prefer right now agriculture, dealing with agriculture, growing farms. They who doesn't have land, they rent and they hire some piece of land and grow some vegetables, some cotton. So migration situation is like this in my country right now. For For comfort, of course, most population in rural areas, they want to move to urban, but there is no economy behind that. There is no resources. There is no living opportunities for urban population coming to cities.
So now, Jess, you've heard all our panelists, and how do you feel we could probably revise or relook the health agenda into all the possible risk that human beings face? Because we've been working in silos in different agendas, and at the heart of it is a person. So what do you think needs to be done over the years? Because of course it's not something we can achieve tomorrow. It would take probably even a lifetime, and even being as ambitious as we can be, it might still be a battle we lose. So what do you really feel needs to be done at different layers, not just from the civil society standpoint, but also from the UN, the government, custodians of COP? So where do you really see this going?
Thank you so much. And I think we see some of those disconnects just here in Baku. In negotiation rooms, we're focused on carbon emissions and on dollars, and we forget that those are related to real people and real lives. And the health community needs to do a much better job, and I speak as a member of the health community, at breaking out of those silos and speaking to other sectors and people, whether they're different sectors thematically or different parts of society, to make that health and person-centered case in the language or the priorities of the people that are taking those decisions. So in agriculture, in the UNFCCC, we know that resilient agriculture systems, it's taken us a long time to even speak about food, and we've only just started speaking about nutrition in the Global Goal on Adaptation. How do we bring all of these issues closer to real people and real lives and real health outcomes? We know that migration has huge impacts on people's health, but we only have seen very, very recently people making the links between climate and health and migration. There's a few new initiatives, but even them I don't think are currently speaking in any depth about food. And if you have to leave agricultural land and set up a new food system in a new location, that's going to really impact nutrition, at least in the short term. And I just think that there are huge links that aren't yet being made in the healthcare community, and the public health community is not yet literate in all of the issues that are going to shape the outcomes that we see for people. So, good call to action for us. I hope it doesn't take us a lifetime, because we don't have one, but it's certainly not something that we're going to solve tomorrow. But really glad to hear from everyone and to listen, and to hopefully be better at this in the coming year or so. Thank you.
So in the interest of time, if I am to ask each of you all, what is it that you would want a COP30 or the future of COP to be like? And what is it that your personal vision for climate goals looks like? What would that be? What would it be where we can benefit from the wisdom and judgment of the work and years of experience you put into really understanding what it looks like? So maybe we can start with whoever wants to go first now.
I'll go first. Okay. I think there's three things that I would hope for this COP, and as we head towards, COP30, but also COP31 and the future. So the first opportunity that I hear that that ties all of us together is the NDCs. So this is where we can have very contextualized plans and priorities that connect the climate agenda to the nature, to people, to food. Those NDCs need to connect all the issues, and you're probably working on your NDC for Gambia and across the region. So this is a real opportunity to have ambitious NDCs that demonstrate how interconnected all of these issues are. Then I think the second one is really thinking about agroecological regenerative transitions that are place-based. And I loved what you said about adaptive agriculture. I mean, what does that look like in every community, in every bioregion, in every... it's really at the subnational level that this is going to play out, and we need to, thirdly, drive climate finance to those solutions, to farmer organizations, women's organizations, to the people who are at the front lines of the climate crisis. So, because they have the solutions, they understand the solutions from a grounded perspective. So NDCs, agroecological just regenerative transitions, and really applying climate finance to those solutions and making sure that there are accountability mechanisms to that get us there.
It's an interesting question. It is regarding this national climate combat. Yesterday I was in one panel. It was in Green Zone. We were discussing this climate action. And the discussion was in direction so that how does this climate change impact the life of people, women businesses, etc. There was a conversation like climate does not affect men and women differently. It affects the same to men and women. So it depends upon survival, upon their reaction to the results of this climate change. And the solution was while if you want to be active regarding combat to climate change, first we have to start from agriculture, because agriculture is grassroots for climate change, for food, for necessary things for life. So it should start from selecting seeds. Which kind of seed people should use to be effective against climate change. One of the main challenges which climate change is attaching to human, it is water. This is lack of water, irrigation water. So use drip irrigation, use economizing the irrigation water, etc. So whatever we do for the nature, it reflects to human body, of course. Some 100 years before, 50 years before, if somebody got sick, they had some tea with jam and it passed away. But now, if you catch a cold, it takes 1 week to be survived. All these are the impact of climate. And there are different places, historically built places, like tombs, like palaces, in Azerbaijan, I mean. When we visit those places, we see that the stone staircases, they are so big. Its height is half meter. You see? Half meter each layer of staircase. We raise with these staircase difficulty. But when it was built, the humans was not in our size. They were tall, they were big, but for ages, the climate change, the results of this environmental harm, it affected the population. Now, if we compare the current population with the one 500 years before, we will see that at that time when this tomb was built, they were not in our size. They were more developed. Their bodies were big. They were healthy. So the environment affects the population not in 10 years, not in 20 years, not only from the year of 16, which you mentioned. It comes from ages. It comes from ages, you know. So we have to try to mitigate its impact. We cannot prevent completely. We can just mitigate. We can have some preventive actions so that it will be reduced, its harm will be reduced. But completely change that results or impact or harm of the environment upon agriculture, upon population, it is really a challenging question. So this is what I...
Thank you.
No, thank you, our colleague from Azerbaijan, and then Turol and Jesse. So I think just two main points here when you talk about maybe considering solutions, looking at the equity and deliberations. And I know you did mention the NDCs, and yes, Gambia, we have one of the most ambitious NDC 2.0. However, there wasn't the availability of anything to implement. And so you really look at the effectiveness of that. And now that we are talking of NDC 3.0 and still cannot figure out the definition of climate finance. And for example, you have local NGOs that work on the ground. Maybe they build an office for them or a coffee shop, and it's been counted as climate finance. And so you really look at what and how those are impacting our most vulnerable communities. And then to the issue of mitigation, and yes, we do need to mitigate. I will take, for example, my country. We produce almost zero emissions. I mean, if you talk about, emission, maybe you're looking at 0.004. And then as a continent, Africa, you're looking at maybe 0.02. And so part of our emissions probably comes from a little bit of livestock that we do, from the rice methane. And so for me, if I talk about the solution to climate change, I'm looking at how can I build the resilience, the sustainability, the need, how do I meet the need of the children? And that's the priority. That's why I mentioned adaptation, especially for agriculture. It would be very difficult if I put now the issues of agriculture and bring in like energy and bring in waste and bring in this into that. And when I don't even produce enough food to feed my people, when I produce nothing to export, that everything we eat, including sugar and meat, it's from the global north. So really those are, it's very challenging. But I think if we are able to deliver and able to build up on where we are, and as you said, it's difficult to solve everything, but as we adopt and mitigate, then hopefully we can get somewhere. And I think that's the same reason why when they talk about differentiated responsibility, and when they talk about the need for the most vulnerables, like the seeds, the LDCs, and in general. So I think we're in this journey together, and I hope as we proceed from Azerbaijan, we have the outcome we expecting, and then take it forward to Brazil. So we cannot wait to start implementation for women, for our children, for our local communities.
Thank you so much to everyone that's gone before me. And I think the two things that I would add are around multi-sectoral collaboration, especially thinking around food and health and climate and how those come together in NDCs, because we know that health is dependent on action across sectors, we know that climate is dependent on action across sectors, and we know that those sectors so often don't speak to each other enough. So just as we've got a UN interagency task force on non-communicable diseases, can we have a UN interagency task force on climate and health? Can we have national coordination mechanisms on climate and health that can make sure that when decisions are taken in the agriculture sector, that those maximise the gains for the climate and for health, and that those feed into NDCs. That would be my first thought. And then my second is on the increased presence that we see from big industries, big health and climate harming industries in the UNFCCC space. So coming again from a health background, we see how in the tobacco control space, the Framework Convention on Tobacco Control says that the tobacco industry has no business in tobacco control policy making, and yet we come here to the UNFCCC and we see agribusiness and we see the fossil fuel industry, and we know that that agriculture and fossil fuels are really deeply intertwined, and Lauren could speak to that much better than me. But how do we continue to put people's efforts, or do better at putting people's health first, and prioritise that over profit-making activities to industries that have for a very long time profited at the expense of people's health?
Dr. Edmond, I'm very happy that I'm sitting with Professor Salimul Haq, photograph with the background. My point is exactly what my colleague said. NDC needs to be ambitious. I'm just citing one example. We have seen many NDCs in the recent times. Many NDCs are really quite ambitious. Some of the NDC I would like to share. Loss and damage has configured as important agenda in NDC 2.0, which Salim fought all through his life. If you look at loss and damage across the sector, it is agri-food system where loss and damage has been quite irreversible. And many of agri-food system impact with the climate cannot be mitigated, cannot be adapted, cannot be minimized. So if you want agri-food system somehow to strengthen, let's use this principle of loss and damage there. Do everything possible to avert the impact on agri-food system, to minimize the loss and damage to agri-food system, and then to address the loss and damage system. The policies, plans, global cooperation framework, if targeted to what we call loss and damage to agri-food system, I think this is the biggest expectations from the Baku Declaration this year, that loss and damage will find expression through NDC. Many countries, and they don't know how to integrate loss and damage into their NDC. My colleagues suggested, many I know government. So the country policy agenda, we need enough capacity to integrate adaptation, mitigation, and also loss and damage into their NDC curriculum. So with that, thank you.
So thank you, colleagues. I think this was a brilliant discussion, and the outcome of it is also live, the discussions we've had. And at the same time, what we would do going back at the CHD group and the Edward and Cynthia Institute of Public Health is put together a policy brief on this conversation so that it could be shared widely with different stakeholders, at least to get the thought process aligned, to stimulate a bit of thinking that our world can't work in fragmented pieces, but it can only work addressing sectoral risk and also looking at different thematic segments which really impact the human being from a social determinant of health perspective. And I personally have benefited from the wisdom and knowledge shared by each of you today, and very grateful on behalf of the Share Hub, on behalf of CHD Group, the Edward and Cynthia Institute of Public Health, Yenapoya deemed to be university, and all stakeholders put together for sharing your precious time this morning in Baku, and look forward to learning more as we go ahead and move into 2025. So thank you once again. And as an outcome of this, I would like to also release my fourth book called Physician's Thoughts. And I request each of you to just hold it for a good photograph, which we can have together. Take one of us.
Accelerate the production and use of our communication. That's the aim. We already produced right.
Yeah, so if we can just stand and have this officially released. It's a very different kind of book release, but just using this opportunity. Yeah, thank you very much. It's fantastic to release a book like this. It's a different experience, and yeah, welcome your feedback. Thank you.